We ready? Before we start, give us your name, tell us where we are, and your title here.
Okay, it's Sharita, Sherita, and it's Golden, Golden. And I am the Hugh P. McCormick Associate Professor of Medicine and Epidemiology, the Johns Hopkins University School of Medicine.
Question: what is diabetes?
So diabetes is a disease that causes the body not to be able to regulate blood sugar normally, and that can happen for two different reasons. So if you have type 1 diabetes, it's because your body can't make enough insulin, and that's the hormone that helps your body to use glucose. If you have type 2 diabetes, which is more common in adults, then you are making insulin, but it's not enough insulin to keep your glucose normal, and we call that insulin resistance. So both of them are abnormalities in regulating blood sugar, but type 1, which occurs more in young people or children, is because you can't make enough insulin, whereas type 2 occurs because you make insulin, it's just that your body can't use it well enough.
Question number 2, and I'd like you, if you can, to work the question back into the answer.
Okay,
Because
gotcha.
they're
not going
me.
to hear you.
Never,
I see.
never.
Okay.
Okay. Why is diabetes so dangerous?
So diabetes is dangerous because often people can go undiagnosed for a number of years. So often people have asymptomatic increases in their blood glucose, and that may only be picked up if they go to the doctor. So if a person goes for years without diabetes being diagnosed, then they could be having damage from high blood sugars to their organs and it not be known to them for a number of years.
Similar question: why is diabetes often called the silent killer?
So diabetes is often called the silent killer because often individuals don't know they have diabetes. But even if you have diabetes, it's rare that a high blood sugar causes pain or causes some other specific symptom that might make an individual go to the doctor. So individuals can go for a number of years with high glucose and really not have a lot of symptoms that indicate that they have the disease.
Can a change in diet and exercise reverse the symptoms of diabetes?
So a change in diet and exercise can definitely reverse the symptoms of diabetes, and it's one of the main tools that we have to complement the pills and other things that we use. So we know that if individuals exercise about 30 minutes, 5 days a week, and that can be something as simple as walking, that can help with weight loss and helping the body to use insulin better, and also making diet changes so that the diet is more low fat and high fruits and vegetables. We know that those things can help reverse the symptoms of diabetes.
What is the connection between diabetes and cardiovascular disease?
So diabetes and cardiovascular disease are very closely linked. They share some common risk factors. For example, being overweight or obese is a risk factor for both diabetes and heart disease. And then individuals who have diabetes are about 2 times as likely to develop a heart attack as individuals who don't have diabetes. So diabetes is an important risk factor for heart disease.
I'm going to take this because I think my man is outside the door.
Mm-hmm.
I'm going to work that question into the answer.
So diabetes causes amputations for 2 reasons. So one is that the high blood sugars that are present in diabetes can damage the walls of the vessels that...
Time out for a second. That's a question.
Why does diabetes cause amputation?
So diabetes causes amputations for 2 reasons. One is that the high blood sugars that are present in diabetes can damage the blood vessel walls that cause normal blood flow to the leg, so that those vessels can start to become blocked. And then it's common that people with diabetes also have high blood pressure. And high blood pressure can also damage the walls and the vessels that control blood flow to the leg. So if those blood vessels become clogged and there's not enough blood flow to the leg, it can cause ulcers and other things that can lead to an amputation if untreated.
What does smoking do to a person with diabetes?
So smoking is really a no-no for people with diabetes. And so what smoking does is it can further increase the risk of heart disease. So we talked earlier about diabetes being a risk factor for having heart disease, but smoking is also a risk factor for heart disease, even separate from diabetes. So the two together is really a double whammy for increasing the risk of heart disease. And smoking also increases the risk for those amputations and blockages in the blood vessels in the legs.
What is the connection between obesity and diabetes?
So obesity and diabetes are very closely connected. So the strongest risk factor for developing type 2 diabetes is being obese. And so that's why we know if we can prevent obesity or treat obesity, then we can also prevent diabetes.
CDC says by the year 2050, half of Americans will have diabetes and be obese. Why is that prediction of some concern, and how can we prevent it? And I want you to work
Right, this was
that
a
snippet
challenge.
in there.
Whew,
Yes,
okay.
ma'am.
So it's predicted that by the year 2050 that over half of Americans will have diabetes or be obese. And the reason that that's important is that we know that we can intervene to prevent the development of obesity and type 2 diabetes. So there was an important study called the Diabetes Prevention Program, and it was a study in people who were overweight and obese who had pre-diabetes. And we know that when those individuals exercise for that 30 minutes, 5 days a week, and change their diet, they lost about 10 to 15 pounds, and that lowered their risk for developing diabetes. So even though that is the prediction that the CDC has, we know that if we can intervene now to develop lifestyle changes and implement them in the population, we can actually reverse that statistic potentially.
Why does diabetes cause stroke?
So diabetes causes stroke for some of the same reasons that it causes heart disease. So it's the high glucose levels damage the blood vessels in the brain, but also because diabetes and high blood pressure occur together commonly, high blood pressure is also a risk factor for stroke. So it's a combination of the glucose as well as the high blood pressure that likely increase the risk for stroke and diabetes.
Why does diabetes cause heart attack?
So I think that's the same as when I asked about cardiovascular disease
Okay.
earlier. Do you want me to say something
Yes, ma'am.
different?
Would you mind
Okay.
answering that specific
Let me try to
question?
let me think about that.
Believe
It's
it
a
or
little
not,
more
a lot of people
specific.
don't know what cardiovascular disease. They
Right.
know what heart attack is.
Right,
But they
gotcha.
don't know. Yeah.
Okay, so diabetes causes heart attack because we know that high blood sugar levels can cause damage to the blood vessels of the heart. And because diabetes and high blood pressure commonly occur together, high blood pressure also causes damage to the vessels in the heart. And then also people with diabetes, their blood cells are stickier, so they're more prone to developing blood clots. And so those blood clots can occur in the vessels in the heart and increase the risk of having a heart attack.
Dr. Golder, would you mind putting your jacket on?
Okay,
We've
I knew you
only
were
got
going to do
about
that.
6
I know, I was going
minutes
to say, I knew
We
you were
gone.
going to. Okay.
7 minutes ahead of schedule.
Okay.
Tell us some of the symptoms of diabetes and what a person goes through that they should be alerted, oh, I might have diabetes. What are the symptoms?
So there are several important symptoms of diabetes that individuals should recognize. So one of the most common is feeling really thirsty and urinating a lot. So what happens is that when the glucose level gets to be a certain level, then the kidneys can't absorb the glucose, so it all comes out in the urine, and that's why individuals will urinate a lot. And what's common is because they're urinating a lot and they're thirsty, they don't know they have diabetes. They'll drink things like 2 liters of soda or a large Kool-Aid. And obviously that makes matters worse because they're putting more sugar in. So if you're really going to the bathroom every hour, getting up at night to go to the bathroom several times, that's an alert that you should note your doctor about. Another common symptom is blurred vision. And so that's because the lens of the eye gets distorted when the sugar is high. So a lot of times people will notice blurred vision and they'll go to see the eye doctor. And the eye doctor may be the one to pick up their diabetes. And what's good about that is that even though the vision is blurred, usually in about a month after getting the blood sugar back under control, that blurriness will improve. Oh, and then the other symptom is if you have unexplained weight loss. And again, even though in diabetes glucose levels are abnormally high, under normal circumstances our body needs glucose. Our cells need glucose for energy. And so what happens is if your body can't use glucose well because the insulin isn't working, then your body will start breaking down fat to get its energy. So people will lose weight. And losing weight is a great thing, but you want to make sure you're losing weight on purpose and not what we call unintentionally.
Could you tell us what if a person has numbness in the fingers and work that that into the answer? Numbness in the fingers and numbness in the toes.
So sometimes people may present early on with diabetes. They may have some numbness in their feet. That could be because they may have had diabetes undiagnosed for a while and might already have nerve damage. But also sometimes the nerves can get irritated when the sugar is high, and once the sugar goes back down, that may improve.
Okay. Did I ask you the question of how does diabetes cause kidney disease?
Not yet. I think
Okay,
that's
that's
really
the
right.
next one. How does diabetes cause kidney disease?
So diabetes causes kidney disease by the high glucose levels damage the units in our kidneys that filter our blood and create our urine. When you have high blood sugars, those units get damaged, and that's what causes the kidney disease. And in addition, I've said this several times, but that diabetes and high blood pressure commonly occur together. So when blood pressure levels are high, that also puts stress on the blood vessels in the kidney and can contribute to the kidney damage and diabetes.
Diabetics and dialysis. What's the connection? Why do people who have diabetes often lead to dialysis? What's the connection, if any?
So the reason that patients with diabetes go on dialysis, if they have kidney disease for a long period of time and their glucose and blood pressure aren't well controlled, it continues to cause ongoing damage to the kidneys. And then when the kidneys can't function anymore, that's when patients have to go on dialysis. But that's often preventable by keeping the blood pressure and the blood sugar controlled.
Why is it that some people who have diabetes have trouble having wounds heal properly or quickly?
So one of the reasons that diabetes causes trouble with wound healing is that the cells that our body has that help with wound healing and fight infection when we have a wound or an injury, when glucose levels are high, those blood cells and those healing cells don't function as well. And so consequently, people with diabetes either don't heal the wound well or may be more prone to having that wound infected.
Why should people with diabetes be concerned if there's an ulcer or a sore on their foot?
So people with diabetes should be concerned if they have an ulcer or a sore because that could be a sign that they have nerve damage. Oftentimes people with nerve damage don't know they have it, and so they may step on a nail or step on something and be unaware. And because they don't feel it, the first thing they may notice is they've developed an ulcer. So this is why it's important for people with diabetes who have numbness to check their feet every day to make sure there's nothing like that. Because once you develop the ulcer, it's a more serious situation.
You're going to group these together. Why can diabetes cause blindness, and what are some of the diabetic eye diseases associated with diabetes?
So diabetes is associated with something called diabetic retinopathy or diabetic eye disease. And what happens is that the high sugars damage the vessels in the back of the eye and cause the lining of the vessels to weaken. And if those vessel linings become very weak, they can rupture and they can cause bleeding in the eye. And that's what can lead to the problems with vision. So we recommend that patients see the eye doctor at least once a year. And if the eye doctor sees that there's something in the back of the eye that looks like it might rupture, they'll do something called laser surgery where they actually burn those vessels so they won't rupture. So that's why it's important to go to the eye doctor to have that addressed.
Right. What is diabetic retinopathy? Or did you answer?
I just answered that.
Okay,
Mm-hmm.
let's go. What is diabetic neuropathy?
So diabetic neuropathy is nerve damage to the feet. So typically it presents as numbness in the feet or burning sensation or sometimes pain. And it's caused because there's high blood sugars causes damage to the nerves. And when those nerves are damaged enough, they can actually die off. And when the nerves die, that's when the numbness sets in. So this is what can cause patients to step on nails, bump their toe and have a cut and not realize they have it until perhaps a really larger ulcer has developed. So it's really important to look at the feet every night.
Doc, I just read this last month, so you can tell me if there's any truth to it.
Okay.
Is there any connectivity between diabetes and Alzheimer's? or diabetes of the brain, or as they're saying that it might be type 3 diabetes.
Right, so there is a connection between diabetes in the brain and diabetes and dementia. So we know that people with diabetes have a higher risk of developing Alzheimer's disease and also of developing dementia. And again, it's thought because it's causing the high blood sugars may be causing some damage in particular areas of the brain that control our memory and our ability to sort of process things and to function with our brain. So not just the high blood sugar, but also the high blood pressure. People with diabetes have more strokes. And so if those strokes happen in areas of the brain that impact memory, then it can lead to things like Alzheimer's disease and dementia.
I'm going to ask you to answer the same question in the same way, but this is targeted to our seniors. Why should seniors who are getting up in age be concerned about diabetes and any connectivity with Alzheimer's and dementia?
So I think our seniors who have diabetes, who are getting older, they should be concerned if they notice changes in memory function or other functioning that's out of proportion to their age, just to make sure that the diabetes is not contributing. And also, one thing our seniors should be aware of is making sure they're not overtreated when they have diabetes, because some of the medicines can drop blood sugar too low. So we have seniors that live by themselves, or they may have a history of a heart attack or stroke. We want to make sure we're not dropping their blood sugars too low with our treatments.
Last two questions. Test a Million program has a bold initiative to test 1 million people for diabetes. Why is the Test a Million program relevant in 2014?
So a Test a Million program is really relevant today because we talked about that CDC statistic that rates of diabetes are predicted to decline. So if we can detect 1 million people early, then we can intervene earlier to prevent complications and to help them with lifestyle changes that can prevent progression of the disease.
One final parting note. Diabetes prevention without a pill. What can Americans do to become less fat, less diabetic? What kind of food should they eat? What kind of food should they not eat?
So I think what Americans can do to really curb the obesity and diabetes is really to make responsible decisions about what they decide to eat. So often our environment makes us feel like we should supersize things because we feel like we're getting more for our money. But the truth of the matter is we're getting more disease for our money. So it's really a matter of making responsible choices about how much you will and won't eat, and really making healthy choices when there's an option, trying to aim to drink more water and less sugar sweetened beverages, try to get that 5 servings of fruits and vegetables in daily, and really monitoring the portion sizes and exercising regularly.
Dr. Saunders' question.
Okay.
Dr. Saunders has been a pioneer in cardiovascular disease, hypertension. He's a part of this documentary and recently said there's a connection between his hypertension and heart disease patients and diabetes. His practice, how, if any, has it inspired you or allowed you to pattern your practice after a guy like Dr. Saunders? What's he meant to the profession?
I think all of us, particularly African American physicians who are taking care of patients with diabetes and cardiac issues such as myself, have found him very inspiring. You know, he's really been a role model for how to combine the research and academic part of medicine with the clinical care of the patients to improve their outcomes. And I think that's what I've been most inspired by.
Last question. I know I snuck another one. What's on the horizon as far as research with diabetes? Drugs, prevention, shock therapy. What's you see? What's on the horizon that might help the next generation of people be less fat, less obese, less diabetic?
Well, I think that there are always new drugs in development to help to treat diabetes once you have it. I think probably our greatest challenge that we still haven't quite figured out is how to fully translate the prevention that we know works into the everyday setting. And so the diabetes prevention program interventions that help prevent diabetes in people who are overweight, it's been translated into the YMCA and into other programs, but really being able to translate those interventions into public policy and how we, sort of how we even like give food to people, even in things like restaurants and things like that. I think that we're really going to need some research on how we can alter and affect our environment to really have the biggest preventive impact. And then finally, I think another important aspect is that we need more research in how to deliver care to people with diabetes, particularly the underserved and minority populations who suffer more with it. So really being able to deliver care within a setting that those patients are comfortable with that's also culturally sensitive, and that's an active area of research.
That's it. One last question. One last question. Is there any truth to the fact that people with diabetes, type 2, have weak minds and they just can't control what they eat? Or is there any psychological, psychosymptomatic thing, or why we can't control this thing? Is it a mind over matter thing, or what?
So the question is whether or not there's any like psychological issue that keeps people with diabetes from controlling their eating or their exercise. I don't think patients with diabetes are any different than the rest of the population. I think that the environment makes it difficult for people to make the right choices whether they have diabetes or not. I do think that there's been research that I've been involved with that shows that diabetes can lead to more mood disorders like depression. So often, if you feel depressed, you're less likely to eat the right thing. You may be more likely to comfort eat and less likely to exercise. So certainly if there's a depression associated, that should be addressed. But in general, there's really not anything that's different in diabetes relative to the rest of the population.
Touchdown. Now, how does this rank? She knocked off. This is one take. I mean,